Dr. Diano. It's time for another Facebook Live from Expert Care. I'm Dr. Diano, the Chief Medical Officer of Expert Care, and I'm also a general pediatrician, and I'm also a mom. And we like to get together with everyone at 1 p.m. on Tuesdays, Pacific Standard Time. Initially this was COVID updates, but now it's just generally a little bit of a talk about a very common peds topic that might be very helpful for parents out there. For COVID updates, there's not much new. It appears that the social distancing is working, so keep up that excellent job you're doing. And also, we're now requiring that kids 2 and older wear a mask in public, okay? A cloth covering, and that's really mostly to decrease the chance that the child is spreading COVID-19. Kids we know are asymptomatic or minimally symptomatic with COVID-19 infection, vast majority of them. And we also know kids aren't super great at covering their mouths and noses when they sneeze and cough. You know what I mean? I saw a meme the other day that said being a pediatrician is an aerosol generating procedure, which is 100% true. So the cloth masks for kids 2 and up is to prevent the chance that the child is spreading COVID-19. This can be weird and scary for kids, but my BFF healthychildren.org has a really great article on how to help your little one get used to wearing that mask. And I'll make sure we put that out there for you guys to see too. It's super helpful. Okay, quick check-in with the technical advisor who texted me and said he's not seeing anything. Let's check in with him one more time. All right. Checking in with that technical advisor. Good to have one in-house. Very good. Oh, we got some reactions. Okay, people do see this. Okay, thank you. So COVID-19, 2-year-olds and up need to wear a mask. Healthychildren.org has a really great article on how to get your little one used to wearing a mask outside. And we'll put that up so you guys can take a look at that later, okay? So that's the major update with COVID-19. And then now we're gonna talk about Pinkeye. All right, Pinkeye is a very common complaint in pediatrics. It's a very common thing we see in childhood. And the thing parents need to know, though, is that not all pink eyes are the same. Not every pink eye requires antibiotics. And so there are typically 3 different types of pink eye that we see in the peds clinic. It's bacterial, which is the pink eye everybody's talking about that needs antibiotics and keeps you out of daycare. There is viral conjunctivitis, there's viral pink eye, and then there's allergic conjunctivitis. 3 different types, and we see all of them all the time. Now from the top, I just wanted to let parents know that, believe it or not, a kid waking up from a nap or from sleeping overnight with their eye totally junky and kind of crusted shut, believe it or not, that is not a useful indicator as to whether or not this is pink eye that requires antibiotics. With every single type, bacterial, viral, and allergic, your child can wake up from sleep overnight or from a nap with their eyes crusted and matted shut. That's not a useful distinguishing feature when we're talking about what kind of pink eye is this, okay? Really, one of the main distinguishers is the type of discharge, all right? That is always the question I have for parents. Tell me about that discharge. And then they'll start to talk about the kid's eye being crusted shut. And I'll say, no. What about when they're awake and they're moving around, walking around, doing whatever they do? What's the discharge like then? Are we talking, thick, purulent, kind of globular drainage that's ongoing while the child is awake and moving around? Or is this more kind of a thin, stringy, kind of mucusy discharge that really just kind of sticks to maybe the eyelashes, and it's not so much of an issue, and maybe you'll wipe it away once or maybe twice during the day, okay? Or is it mostly just kind of watery? These are important distinguishing features, okay? So for bacterial conjunctivitis, the type of conjunctivitis, the pink eye that needs antibiotics and it's going to keep you out of daycare, that is thick, purulent, ongoing drainage from the eye, okay? It is constantly going. You constantly need to wipe it away from that kid's eye. Best example I ever had was a 5-year-old in clinic who mom brought in to talk about the eye, and just once every 90 seconds or so, you had to reach over and like wipe this kid's eye because there was more thick, purulent, globular stuff coming up there at the corner. Okay, that's one of the main distinguishing factors. All right, the bacterial pink eye, other things we can talk about. It is highly contagious. Both this and viral conjunctivitis, though, are very contagious and are spread typically by contact with the secretion. So the kid touches their eye, or they wipe their eye on something, and then the next person touches that thing that's been contaminated and touches their eye. Okay, so typically it's inoculation via touching secretions. All right, both bacterial and viral, both are highly contagious. Only one needs antibiotics to keep you out of daycare. All right. Now, bacterial conjunctivitis can be unilateral, can be bilateral, but this one can show up as unilateral. There is redness of the white of the eye. There's that thick, purulent, ongoing, thick drainage that we talked about. That's the key feature. And more the discharge is there just within minutes of wiping it. That is a bacterial conjunctivitis. And just looking at my notes real fast. And we give antibiotic eye drops for that. And typically you can go back to daycare within 24 hours of starting those antibiotics. Okay, so that's bacterial conjunctivitis. That's the pink eye that needs antibiotics and a note to go back to daycare. Okay, viral conjunctivitis is often bilateral and usually comes as part of a constellation of symptoms. So that child has other signs or symptoms of illness, other cough, cold type symptoms, fevers, feeling real run down, URI cough, maybe some tummy stuff. That kid has other viral stuff going on plus a pink eye. Okay, often both eyes are involved. The whites of the eye are kind of red and irritated looking. That drainage is kind of thinner, more stringy, and it's kind of watery, mucusy kind of consistency, very thin and kind of stretchy. Don't ask me how I know that. Okay. But it's the same thing with bacterial conjunctivitis. The kid touches their eye, or they wipe their face on something. Next person comes along, touches that, or is touching the kid's face and then touches their eye, and they infect themselves. That type of conjunctivitis. It's also more like cough cold related. Excuse me, I'm so sorry. I looked at the wrong part of my notes. It's more cough cold related. It's part of the cough cold symptom. A lot of times, if the kid can talk and can tell you things, they'll complain this is kind of like gritty or sandy feeling in their eye. So we see that a lot with the viral conjunctivitis, kind of gritty, sandy feeling, irritated feeling in their eyes. It can start unilateral. Viral conjunctivitis can start unilateral, but that second eye typically is involved in the next 24 to 48 hours. One of the things you can look for is with viral conjunctivitis, as well as allergic conjunctivitis, which we're about to get into, if you pull down the lower eyelid and look at the skin inside the lower eyelid, that's called the tarsal conjunctiva. And that skin inside the lower eyelid will look real bumpy, kind of cobblestoney if we're dealing with a viral conjunctivitis. Not typically something you see with bacterial. And with the viral conjunctivitis, a lot of times these kids can have enlarged preauricular lymph nodes. Okay, so the lymph nodes that live right here in front of the ear. We can have some enlarged or tender lymph nodes. Okay, and so that's what we got going on for the viral conjunctivitis. Okay. And as always, if you guys have any questions, please feel free to drop them down. Let me know. I'll answer them to the very best of my ability, and I will come back around and I will I will answer them later on after the live feed's done too. So I'll keep checking back. I'll keep checking back on your questions. Okay, allergic conjunctivitis, the third kind of pink eye. Again, bilateral redness, okay, of the whites of the eyes get red. There's a lot of profuse watery discharge. This is by and large a watery discharge, okay? And there's a lot of itching. Itchy eyes are a cardinal feature of allergic conjunctivitis. Rubbing eyes can actually make the symptoms worse. So if the kid's always digging at their eyes and it makes things worse, there's a really great chance that's allergic conjunctivitis. And one of the big giveaways for allergic conjunctivitis is that there's a history of allergic disease in that child or in immediate family members. So like mom, dad, brother, sister. Mom, dad, brother, sister patient have eczema. They have a history of allergies. They have a history of asthma. There's a great chance that child also has allergic rhinitis. All three of those things like to travel around together. And if you or a family member has one of these three conditions, there's an excellent chance that the patient has one of these conditions. Okay. Like viral conjunctivitis, there's that diffuse redness of the whites of the eyes. And again, if you pull down the lower eyelid, that skin inside the lower eyelid, that tarsal conjunctiva, can look real bumpy. And that's what we see with the viral conjunctivitis. And why is this important? It's important for a lot of reasons. You have to use the right medication or things aren't going to get better. Who needs to stay out of daycare? Who doesn't have to stay out of daycare? Just to review, bacterial conjunctivitis needs antibiotic eye drops, and kids can typically return to daycare or school within 24 hours of initiating those antibiotic eye drops. Viral conjunctivitis, it's a viral illness. If the kid's afebrile and not vomiting and still typically functioning well, that kid can go to school. There's no reason to keep that kid out of school. And viral conjunctivitis, if you need to use, allergic conjunctivitis, you need to give that kid allergy meds to make him feel better. Little kids take Zyrtec most often. Older kids can take Flonase. And kids who have real problematic eye symptoms with their allergies, there are specific anti-allergy eye drops we can give those kids. So it's important. It's important to know what medicine to use to be effective, who needs to go to school, who doesn't. I definitely had a kid with really horrible allergic conjunctivitis who kept getting kicked out of school because the teacher thought he had some weird refractory bacterial conjunctivitis. That kid just needed a really good documentation and a change up in his medicine. But there's no reason you need to leave school for allergic conjunctivitis. There's no reason. And your doctor should be able to give you a note for that. So that was Pinkeye. Quickie talk on Pinkeye for my family friends, for all the moms out there and dads and whoever's watching. And one of the last things I wanted to talk about is next week I want to do a talk on nursery discharge teaching. So this is something pediatric residents and pediatricians are very familiar with. If you had a baby recently, you might remember, or you might not. It's totally fine. Very understandable. We come to your room, or sometimes all the moms and dads that are leaving the hospital that day with their baby, they all go to a specific classroom, and we kind of run down the most important things you need to know about your baby. General questions, stuff like that. What's an emergency? What isn't? Tech Advisor is texting me. Okay. All right. We just run down some general red flags when you need to bring your baby back to the emergency room, and other commonly asked pediatric questions. I was going to do that next week. If there is something specific you would like to hear me talk about, please drop it in the comments for this video, or send us a direct message, or post it on our expert care page. I was also going to put out a poll at some point in time, so you could pick some questions that you might like. So yeah, next week we're going to do discharge teaching for our lecture. Let me know what you want me to cover. And also, just throwing it out there, people keep telling me that I should do a show where I talk to one of my other pediatrician friends after we've had a couple drinks. Is that something people actually want to see? Would you like to see two pediatricians talk about peds after they have had 2 glasses of wine? if you want to see it, I'm here to provide education. So let me know if you want to see two buzz pediatricians talk to each other about pediatrics. I defer to your educational needs. Okay? I hope everybody's doing really well. Stay home, stay safe, and stay sane, and it's all going to be great. And I'll talk to you guys next week, unless you need me sooner, okay? All right, have a good one. Bye.